In the previous module, you learned about what are ventilators, what are they used for, and what are the benefits and risks. If you haven't listened to that audio and you are not familiar with that content, be sure to go back and listen to the series before you start this one. Let's get started. In order to truly learn and understand mechanical ventilation, it's necessary to know the different ventilator modes. The following are the modes of a mechanical ventilation. The first is volume modes. Volume modes work by delivering a set tidal volume. There are a couple different types of volume modes. First, you have assist control ventilation, AC, or continuous mandatory ventilation, CMV. In this mode, when the patient makes an effort to breathe, the mechanical ventilator assists by delivering a necessary mechanical breath. AC is contraindicated for patients who breathe rapidly because it may result in lung hyperinflation. The other volume mode is synchronized intermittent mandatory ventilation, SIMV. This mode detects the patient's inspiratory effort and provides a certain number of breaths depending on a set rate. For instance, if the set rate is 12 breaths per minute, the mechanical ventilator will provide 12 mandatory breaths in 1 minute, while also allowing the patient to take spontaneous breaths between the mandatory breaths. The second type of mode you need to know are pressure modes. Pressure modes work by delivering a set pressure called pressure-controlled ventilation, or PCV. In PCV mode, the ventilator provides constant pressure during patient's inhalation. PCV is recommended for patients with neuromuscular disease but with normal lungs. There is also pressure support ventilation, PSV. This mode allows spontaneous ventilation by allowing the machine to deliver support while the patient regulates his or her own respiratory rate and tidal volume. Another pressure setting is pressure-controlled inverse ratio ventilation, PCIRV. In this mode, the operator sets the time of inspiration to be longer than expiration. PCIRV is recommended for patients with acute respiratory distress syndrome, or ARDS, which patients with severe COVID-19 disease typically develop. The last type of setting is airway pressure release ventilation, APRV. This unique mode of ventilation allows the patient to spontaneously ventilate at both low and high pressures. This mode of ventilation is recommended for ARDS patients as well. The third type of mode is dual modes. These modes work by allowing you to set the volume and pressure. With dual mode, you have a setting called Pressure Regulated Volume Control, PRVC. This mode delivers constant pressure applied through inspiration, regardless of whether breath is initiated by the patient or an assist breath. Now that you have some understanding on the different modes, let's talk about ventilator settings. There are 5 basic ventilator settings that you should know: tidal volume, respiratory rate, positive end expiratory pressure, or PEEP, fraction of inspired oxygen, or FiO2, and flow rate. These are the vent settings determined by the physician or advanced practice provider that your respiratory therapist sets. This is important information to know, especially for handoff to the ICU. In most cases, all vented patients require an ICU admission. Let's break down the ventilator settings. First is tidal volume. Tidal volume refers to the lung volume. Tidal volume represents the normal volume of air displaced during normal inhalation and exhalation when a patient does not exert extra effort during breathing. In young, healthy male adults, the value of VT is approximately 5 to 8 milliliters per pound of ideal body weight, IBW. The next setting is respiratory rate. This refers to the number of breaths a patient takes per minute. Normally, healthy adults who are at rest have an RR of 12 to 20 breaths per minute. The third setting is positive end expiratory pressure, or PEEP. This is the pressure applied by the mechanical ventilator at the end of each patient's breath to ensure that the alveoli do not collapse. Normally, the alveoli expand during inhalation to allow the air to come in. Gas exchange then happens as the blood flows past the alveoli's wall. During each exhalation, the alveoli contracts in order to excrete carbon dioxide. In patients with impaired ventilation, PEEP reduces trauma to the alveoli by providing sufficient pressure during inhalation and improves oxygenation by increasing the surface area for gas exchange and functional residual capacity. The fourth setting is the FiO2, or fraction of inspired oxygen. Simply put, it refers to how much of the air a patient breathes is actually oxygen. Usually, FiO2 is set at 100% at the initiation of mechanical ventilation so that the patient receives maximal amounts of oxygen during the adjustment period and during initial attempts to achieve a stable condition. Again, these are settings established by the physician or advanced practice provider. The last setting is the flow rate. The flow rate refers to the maximum flow delivered by the mechanical ventilator during inhalation. It's volume divided by time. Normally, a flow rate of 60 liters per minute, or more is enough to stabilize a patient's condition. A low flow rate can lead to dyspnea and other breathing problems. So, those are the ventilator modes and settings in a nutshell. Hopefully this information provides you with a better understanding and helps you feel a little more comfortable managing ventilators if and when that time comes. Be sure to listen to the next module in this series of audiocasts on ventilators when we talk about ventilator alarms. Resources used to develop this audiocast include the American Association for Respiratory Care, Johns Hopkins Medicine, Merck Manuals, and the Centers for Disease Control and Prevention.